Retinoids are the OG of skincare for everything from acne to anti-aging.
It helps to thin out skin, improve texture, improve pigmentation. So anything that has those issues, like
How do you know which one is right for you? And more importantly, how do you use them without wrecking your skin?
dark knees, dark elbows, thick plaques like in psoriasis. It can help to thin out the skin in a good way. And it also like stimulates collagen. So
It's about finding the one that works for your skin while minimizing that irritation, something that you can use more long-term. It's all about that consistency. It's a marathon, not a sprint. The benefits that you're going to see comes after 3 to 6 months and years of use. It doesn't happen overnight. All right, you've heard the hype. Retinoids are the OG of skincare for everything from acne to anti-aging. But with so many options out there, Retinol, Retinate, Tretinoin, adapalene, tazarotene, how do you know which one is right for you? And more importantly, how do you use them without wrecking your skin?
okay, in this episode, we are diving deep into the world of retinoids. We're going to break down one, what each type of retinoid is and why people use it. 2, the pros and cons of each one. 3, common mistakes because yes, there is a right and wrong way to use them. 4, who should and more importantly shouldn't be using them. And number 5, the best protocol to follow for maximal results without irritation.
That's right. We're covering everything from beginner-friendly retinol to prescription-strength Tretinoin, and even the newer players like adapalene. If you've ever wondered why some people swear by retinoids while others say it destroys their skin, this episode will clear things up for you.
We're going to be sharing a lot of tips and a lot of product recommendations, so be sure to download the PDF linked in the show notes that will contain all the key takeaways and links to the products we discussed. Also, be sure to hit that follow button on Apple Podcasts or Spotify or YouTube to never, ever, ever miss an episode. And if you've been loving the podcast so far, we would really, really love it if you could leave us a rating and a review. It will so much help the growth of this show. But before we dive in, I wanted to introduce myself. I'm Dr. Lindsay, a board-certified dermatologist.
And I'm Dr. Jenny, another board-certified dermatologist, missing our trio in crime, Dr. Mamina.
Today, we're really going to dive deep into retinoids. But before we even talk about retinoids, I think that we really need to explain why we're dedicating a whole episode to retinoids. Jenny, what can you tell us? What can you tell the listeners about retinoids? Why do we love it so much? Why is every derm talking about retinoids?
It is the most studied ingredient probably in skincare. Dare say that? Yeah, I think that is right. With so much evidence, not just for anti-aging, but also acne. We use it even off-label to help like thicken skin, like acanthosis nigricans, dark neck. Some people call it like keratosis pilaris. I mean, and ichthyosis too, right? Topical things. Just so many uses and benefits. But retinoids are essentially derivatives of vitamin A. And vitamin A plays a really important role in your skin, the way your skin functions. And it really helps with so many things, improving skin turnover, helping with unclogging pores. And that's why it helps with acne, but also has been shown to help with inflammation, also indirectly helps with acne and also with collagen boosting benefits. And that is why, I think that's why we all love it. But I'm probably missing something. So Lindsay, dive in.
Yeah. So retinoids really are the gold standard when it comes to aging. When you take off, sunscreen off the table. So you will not find a derm, I think, that doesn't use retinoids. Maybe few and far in between. But it really is. I say this a lot, but I truly mean it. It is like the one product, the one ingredient that seemingly does it all. Now, it is FDA approved for acne, but we use it off label for so many things. And especially when it comes to acne, it's so good at increasing cell turnover. That's why it's so great, especially with those comedones, those blackheads and whiteheads in acne. But we'll also use it because, again, think about the way that it works. It helps to thin out skin, improve texture, improve pigmentation. So anything that has those issues, like Jenny mentioned, dark knees, dark elbows, thick plaques like in psoriasis. It can help to thin out the skin in a good way. And it also, like Jenny mentioned, stimulates collagen. So when you're stimulating collagen, which is something that we lose every year, especially once we hit our 30s, and collagen is what gives us our plump, youthful look. So by stimulating new collagen gives us a more youthful look, and it helps target pigmentation as well. So it really kind of does it all.
Yeah, and also we didn't mention, like, we even use it off-label for kids who struggle with like molluscum and warts to help treat that. So many different uses. As you were speaking, Lindsay, trying to remember, there was an article I read a few years back from like the JDD, Journal of Drug Dermatology, on tretinoin. It was like 40 plus years of history and kind of clinical data, and like literally like 20 different uses that we derms have for tretinoin. So it's just, it's like the one that we all have in our arsenal for various different things. But the best studied, especially if you want to treat your acne and have some great anti-aging benefits.
Often imitated, never duplicated. Tretinoin and retinoids are this gold standard. So, okay, well, we've talked about like why some people would use it and what they are and the benefits, but those are the pros. But let's talk a little bit about the cons. Like, obviously, it's not the perfect ingredient, right? And it might even be a little too good to be true. And why is that, Jenny?
Well, the first thing is that, especially when it comes to prescription, is just the irritation. The way the retinoids work on your skin, especially in the beginning when you first introduce a topical retinoid, it really helps to normalize or even speed up that cellular turnover that tends to slow down as we age. And so with that, as it's kind of almost like breaking down your skin barrier to form a better skin barrier in the long term, you're temporarily going to get really irritated and dry. And that is called the retinization period. And almost everyone goes through that in the beginning. And some people even kind of develop it during the course, especially say if they're introduced new products into their skin, or say temporarily stopped it and reintroduce it back into their routine. But that dryness and irritation definitely is so real. And that is why I think we have like over-the-counter retinol or retinal products was to really design to maybe mimic that benefit, but less irritation. But by far it's just the irritation. Probably the most common reason why we hear people say, I can't tolerate or I can't use a retinoid is that dryness, redness, peeling, breakdown of your skin barrier, or maybe even damaging, quote unquote, your skin barrier.
Let's talk about the two things that people on social media want to hear about. Number one, the retinoid uglies, and number two, purging. So let's talk about those and the difference between the two. So first, I think let's talk about the purging. So purging is thrown around a lot on social media, and it doesn't happen to everybody. What purging is when you have maybe acne, for example, and you're using a treatment like tretinoin, and your skin sort of breaks out even more. And so what that is, that typically happens in the first probably 2 to 4 weeks of using a retinoid. And that's actually it can be a normal thing. And I see this on the oral version of tretinoin called isotretinoin. And it means that because the cell turnover is increasing rapidly, all of those comedones and blackheads and whiteheads and pimples and microcomedones are coming more to the surface much quicker and at the same time than they would on their own without the medicine. So purging does not happen to everybody, so don't be afraid of it. And if it does happen, it doesn't last for a long time. And it can kind of be seen as a good thing because you're getting rid of your acne at a much quicker pace.
But a couple things to add. It's almost like that hair loss with topical minoxidil. Not everybody responds to minoxidil. So when you actually get that hair loss, which is so frustrating with it, it actually means you're responding and working. Two, I do feel like social media has blown purging out of proportion. Like it's actually not that common. In fact, when I see patients, it's mostly with oral Accutane, not so much with topicals. And now, next thing you know, everybody is asking, am I purging with niacinamide? Does azelaic acid cause purging? No, probably is more irritation.
Or you're overdoing it on the skincare,
you're overdoing
probably.
It. Guys, purging doesn't happen all that frequent.
You're not purging, you're just screwing up. I said what I said. No, I'm sorry. I get it. It's a very complicated topic, and social media is really pushing it down your throat.
Yeah.
So I understand why people think that they're purging,
Yeah.
but hopefully you're learning from us and we're helping you. But
Yeah.
Jenny, why don't you walk us through the retinoid uglies, the dreaded
I know.
retinoid uglies? Like, what's the deal?
Basically, AKA, that is that retinization period that I talked about earlier. So this is where when you are really new to retinoids, your skin is adjusting to what the retinoid is supposed to do, AKA in kind of improving that skin turnover. And as your skin kind of turns over more quickly, it has to just basically form new skin cells and get better and look healthier, but it kind of almost has to break down to get better. And so with that temporary phase, the first like 2 to 4 weeks is most people, when they experience this retinization, they're getting dry, they're getting flaky, they're getting irritated. Things like products, moisturizers and sunscreen may even burn on their skin. Their skin looks red. So this is also why we as dermatologists recommend that with retinoids, you pick low and you go slow to really help to maybe offset some of that potential retinization, that reaction, and also moisturize. That will help, and then sunscreen during the day. But yeah, this is, I would say, probably retinization, would you agree, Lindsay, happens way more readily than purging.
100%. And it's almost guaranteed that you're going to go through a little bit of the retinoid uglies. Not necessarily, but I have rarely seen a patient just start using it and tolerate it just fine. So I think, like, I don't even want to wait till later in the episode to dive into this. I think the listeners want to know, they need to know the common mistakes on using a retinoid and how you can avoid that. So I think we should go back and forth and give our most actionable tips and the ways that we would speak to a patient on how to be able to tolerate this. So number one, like you mentioned, I'm just going to give it a name, is the retinoid sandwich. So I swear by a retinoid sandwich. And what that means is, if you're having trouble tolerating a retinoid, I wouldn't initially start this way, but if you're really struggling with it, I would put a moisturizer on first, then do your retinoid, then sandwich that with another moisturizer, because what that's going to do is almost act like a very soothing barrier between your skin and that retinoid, so it doesn't absorb it too much, or you're like pre-treating it with moisturizing ingredients to reduce that irritation and those flakes. And so again, I wouldn't start out by doing that, because I always recommend active skincare be applied as close to your skin as possible so that you get the best benefit. But if you're truly not tolerating it, you want to sandwich that.
Yeah, no, I love that. In fact, that is what I recommend to my patients in the wintertime if I'm starting them on a prescription for acne or for anti-aging. And actually, that's often what I do, just because where I live is so freaking cold. But if you have like oily skin, you could probably just jump right into because the other question I get asked is like, okay, moisturizer before, after sandwich, like, and also how long do you wait between each step if you are layering, right? And then also, do you apply, oh my God, we're going to get super complicated. Like, do you apply Tretinoin on damp skin, on dry skin? I think we should all demystify that, because there's so much question and so much confusion with the do's and don'ts. But like, so guys, wet skin basically means enhanced penetration. There's certainly times you want that. Like, for example, damp skin with moisturizer is going to seal in that water content, keep your skin more plump and
like
hydrated.
Hyaluronic acid works best on damp skin.
Right. But keep in mind, because you're enhancing penetration with a retinoid, depending on the retinoid and depending on your skin, that could also increase irritation. So if you're dry and super sensitive, or if you're new and using a prescription, this is why dermatologists recommend dry skin. With the exception of, I think what, Lindsay said, is the recommendation of like that sandwich. You do want to put on a moisturizer on damp skin. If you're going to do that sandwich method, your first layer of moisturizer damp, wait, 30 seconds, a minute. And then once your like products absorb, that moisturizer is absorbed, then your tretinoin, after you massage that in there, another 30 seconds, then like your top sandwich of your moisturizer. Because like everybody asks, like, how long do I wait? I don't really feel like there is a magic number, right?
It does not matter. I think people really get like bogged down in those details, but there is no magic number. Just what I'll do is I will put my skincare, put that layer on, and then I'll go and, make the bed or something. And then I'll do it. Then I'll come back and I'll do it. So I don't just sit there like a weirdo and just be like, was that 30 seconds? Was that a minute? I'll like do other things. I'll go and put my clothes on. I'll go get a drink of water. Like, don't complicate it, guys. Don't.
Yeah. No,
okay. I also think people really want their skin to be better. So a big mistake I see people make is just going too hard. They're going hard in the paint, okay? And you don't want to do that when it comes to a retinoid. So low and slow is the name of the game, okay? You do not want to aggressively put too much of it on. That's mistake number one. And number two is doing back-to-back nights. And I understand that people want their skin to look better like tomorrow, but this is an investment. It is a marathon, not a sprint. And unless you want like a chemical peel on your face, which maybe you do, I don't know, you do not want to do when you're first starting out with Tretinoin back-to-back nights, and you don't want to use too much.
Absolutely. Okay, so now the question is, what size is your pee? Oh my gosh.
I heard from somewhere that Gen Zers don't even know the size of a pea, so it's better to say the size of a chocolate chip. But,
oh my gosh.
Yeah, I think that's variable, but whatever your pea size
depends on the size of your it depends on the size of your face. So I actually read, this is where my gauge, I tell them, look at your index finger and basically where your distal joint is, about roughly half of that length is a decent sized pee amount. So use that as the gauge, like use your finger. So that's what I tell my patients. And I feel like I read that somewhere. I was like, you know what? That is a good visual for what I tell my patients, because everybody's pee is a little bit different.
Yeah, I hear that. But the point is, more is not more. You don't want to overdo it. You're not going to get any more benefit, and you're probably just going to screw your face up.
Yeah.
Like,
similarly, don't mix your retinoids with a moisturizer. We should also talk about like how to apply it, because that is also like a slippery slope too, where, if I mix it with my moisturizer, it's going to be like more even application, less irritating. No, the problem is when you're mixing, you're never going to really create a uniform like distribution, and you're going to get hot spots. And so, and also worse yet, don't dump your tretinoin tube into like that CeraVe jar moisturizer. You're going to deactivate that. I mean, that is why Retinol is in that tube that's opaque and sealed, because it's so labile and can become deactivated easily. So what you want to do is, whatever method you're using, basically put on your pea size amount and you dot it across your face. So usually like a couple dots across the forehead, maybe a few down your nose, your cheeks and chin. Rub that in and then do your moisturizer, or you could maybe do your moisturizer beforehand. But do not mix with your moisturizer.
That is a lazy girl hack that we do not approve of. So don't do that. And then I also want to go back to the low and slow too. I think that you don't, I know I mentioned this, but you don't want to apply it every night at first. Eventually you want to work yourself up to it if you can, and that's what your derm recommends. But I don't know what you recommend, Jenny, but I'll tell my patients, especially if they're on the sensitive side, I'll even say twice a week. So at first, twice a week, see how you go, not back-to-back days. Maybe the next week, try to increase it to 3 nights a week. See how your skin is. If you're flaking, if you're going through the Tretinoin uglies, we don't want that. We want you to feel comfortable in your skin. So I will just say, just take your time. I mean, the best benefit is when you are using it consistently. But I tell patients, if you can only use it 4 nights a week, you can only use it 4 nights a week. But the goal, ideally, you'd like to use it as many nights a week as possible.
Yeah. And
especially for acne.
Absolutely. I keep going off tangent because there's so many things we're going to talk about. Because going back to that, like how many times a night a week, it's like acne, the more you can use, the better. But if you're just using for anti-aging, 3 times a week has been shown to offer effective results with consistent use. So do as much as you can, but also take breaks if you need to. That's the other thing too. If you are using it, even if you're going low and slow and you're noticing some discomfort, irritation, like take a break for a few nights and then restart back. And when you do, maybe even like restart even slower than before. In the wintertime here too, I will even tell people twice a week, and then only add an additional night per week, or like as you tolerate. And over the span of maybe even a month or longer, try to get yourself up to like nightly if
Yeah.
possible. Yeah.
Let's talk about how to either prevent or treat the retinoid uglies too. I think a really good hack. Well, actually, let's say slugging with tretinoin. Yes or no?
Depends on what you're slugging with.
There you
Petrolatum.
go. Yeah.
Yeah. So you said petrolatum.
And how you're slugging too. So slugging, full face slugging versus semi slugging. Let's talk about it and how to incorporate that into your tretinoin routine.
Yeah. So I think actually, if you use a little petrolatum around your eyelid, like the corners of your eyelid, the creases of your nose, the corners of your mouth as a barrier, just like spot treat those areas before your tretinoin, it actually can prevent the tretinoin uglies from happening, those are common places where people tend to flake and peel.
Because they're more sensitive. They're thinner skin, they're more sensitive.
Yeah. So that's more almost like acting as a barrier. But what we don't want you to do is put on your tretinoin and then slug with petrolatum, because petrolatum is such a great occlusive. It literally enhances the penetration of what you just put on beforehand. So in this instance, if you're putting on hyaluronic acid, great, you're getting that skin hydration. But if it's tretinoin, you're just increase the penetration and potentially the irritation. So no slugging with petrolatum.
And for those listening, if you're not on the TikTok and you don't know what slugging is, it's a trend where people are putting an occlusive, usually Vaseline or an ointment, all over their face to really increase hydration and transepidermal water loss in their skin. So slugging with tretinoin overall is a no, but semi-slugging in the areas to prevent irritation is a yes.
Yeah. Now, some people will kind of slug with thicker moisturizer, and I think that is a great way to actually support your skin barrier and kind of complement your tretinoin regimen. So like a barrier cream out there that I know you and I both like Aven, Cyclofate, like that I think is
so good.
Yeah.
I mean, that is just like, it's again, also like a semi-slugging where it's not really, really heavy like a petrolatum, but it is very moisturizing as well. So big fan of Aven Cyclofate for tretinoin use.
So semi-slugging we approve.
But
not with petrolatum.
Okay, well, what about like who is tretinoin for? Who should use it? Who should avoid it?
Yeah. So let's talk about this, and then we should talk about like the retinols and then the different classes, because I think that's also like, you probably get asked the same too, like adapalene, like do I use that for anti-aging? Can I use it for anti-aging?
For sure.
So maybe let's start with tretinoin, because that is the one that we all talk about. That is the OG. So that obviously we use it for acne, and for prescription strength. That comes in 0.025, 0.05, and then 0.1 is the strongest. There's various different types like creams and gels, but usually we all like creams because it's far less irritating. I mean, that literally is, aside from acne, probably the go for anti-aging. It doesn't mean that that is where you necessarily need to start, but certainly somebody in their, say, mid 30s or even 40s and later, and really want to do something that's going to be effective for uneven skin texture and skin tone, that would be a great one to start with. And then if you have acne and also struggle with anti-aging concerns, that would be one that I would recommend.
Yeah, so I think people ask all the time too, well, what's the difference between Retin-A and tretinoin? Well, Retin-A is just the brand name of tretinoin. And so there's also other prescription retinoids out there too, like tazarotene and a brand name called Araslo. And so they're all different. They're all essentially retinoids, and they all just target slightly different receptors. But all of those are approved to treat acne. None of them, actually, I don't know if any of them are actually approved to what's the one that
I think I want to say is but Renova is, I believe, right? Renova is like a brand name.
There's the one. What's the one? Never mind. We won't talk about that. Okay, so there's Retin-A, which is the brand name of tretinoin, and then there's also tazarotene, which is they all kind of target different receptors, and then there's adapalene. So adapalene used to be prescription only, and I don't remember when it happened, but since we've been alive, it's been now available over the counter. So that's been a really game changer for people with acne, because that is such a great option for people with mild to moderate blackheads and whiteheads, what we call comedonal acne.
Yeah. And then the other thing too is adapalene does come in different concentrations, and so does tazarotene. And so the one that's over the counter is 0.1%. There is a stronger, I don't even know if people prescribe that anymore, but that 0.3%. And then as far as like the anti-aging benefits for adapalene, most of the studies are the 0.03%. That's what we know. That's been shown to, yes, offer some benefits, improving uneven skin texture and improving skin tone. So we can only extrapolate for the 0.1%. Now, I do think you're probably going to get some benefit. It's kind of like that azelaic acid, 10% versus 15 and 20% for like hyperpigmentation. I think it probably does offer some slight benefits, but as dermatologists, we can't come on and say, oh yeah, adapalene is the same as tretinoin for anti-aging, especially the one over the counter. So it's one of those, like if you have acne and you struggle with some anti-aging concerns and you can't see a dermatologist and you tried retinol and it's not helping, I think the next thing to try would be adapalene, but certainly like tretinoin is still the OG for anti-aging. Okay, so here, Lindsay, here's another question I always get is, okay, I'm on the 0.025. Should I be going up? Should I be using tazarotene? I've been on tretinoin for like X number of years. What is your take on strength, and should you titrate up for anti-aging?
Yeah, I was just going to say, I think it depends on what you're using it for. Now, for acne, I think the strengths can make a huge difference. If you're on the lower dose or the lower strength of tretinoin, maybe the 0.025, and you're not seeing results, or you have pretty severe deep-seated blackheads and whiteheads, then you very likely need a much stronger version, the tretinoin 0.1%, the tazarotene or Araslo to knock those out. But when it comes to anti-aging, I mean, I think you mentioned this, is higher doesn't mean better, especially if you are burning your skin off, if you're getting flakes from it, because we mentioned this before, when you're dry, when you're flaky, your fine lines and wrinkles are going to look more prominent. And so what improvement you're getting with the retinoid, you're losing that by looking super dry and flaky in your anti-aging journey. So I typically recommend that you don't really need anything more than a tretinoin 0.025 or maybe even a 0.05 if you're on the oily side, but no need to push it to a tazarotene if you don't need to. You can get excellent anti-aging benefits at that lower to mid tretinoin strength. Although with all that being said, I love Araslo. That's like the one that I use, but it's a different molecule and it's in a different formulation. So that's it's really, really moisturizing. And so I really like it. And I'm very oily too. So that's why I like it.
Yeah, I mean, this is where I do think like Retinol, it's way more expensive than generic tretinoin, but it's encapsulated, and I believe it does kind of reduce some of that irritation of the compared to like generic tretinoin. Like really well said. I mean, if you look at the studies, yes, higher strength and higher strength of tretinoin, so like 0.1%, did show some better improvement compared to 0.025. I mean, tazarotene did show like faster onset of results, but when you see those differences, it doesn't mean that it's applicable to you in the sense, yes, when they did all these like measurements in the lab setting, there was improvement, but it doesn't always or like when they did biopsies of the skin, I believe there were a few that did biopsies, they saw some improvement histologically, but it doesn't always translate to relevant like clinical, like what we see on your skin. And like Lindsay said, it's so much more that you can use it more consistently long term. And if you can only use tazarotene like once a week or only every few weeks, but tretinoin like consistently, you're going to get way more benefits from the tretinoin than using like random times of the tazarotene, or seldom times that you do use this tazarotene. And also keep in mind, it depends on like how much sun damage or aging you have. Like at the end of the day, if you have like wrinkle city and your skin is sagging, there's no tazarotene out there that's going to fix your issue. This is where you need to combine it with probably in-office procedures, microneedling, laser, fillers, Botox, right? We love retinoids, but they can only do so much.
Totally. Well, speaking of though, prescription retinoids. What about, let's talk a little bit about over-the-counter ones, because I think there's just a lot of confusion on retinols and retinaldehydes and retinoids and what's the difference. And I think we should rank them for people so they can kind of get an idea of where they fall in terms of strength and what you can and can accomplish with it. So Jenny, can you break down for us the over-the-counter options before we put them all out there and rank them?
Yeah. So first, let's just kind of going back to the basic science for a minute. So tretinoin, why it's the OG and why it works so well, but also why equally irritating is literally it's the active form. So retinoic acid. This is the molecule that acts on our skin cells, binds to our skin receptors, and it's doing the things it's supposed to do. But also it's the most irritating. So then when you look at retinol, which is a cosmeceutical ingredient, that needs to be converted to retinaldehyde, or AKA retinal. Retinal is then converted into retinoic acid, which is, so that two-step conversion or even one-step conversion makes kind of dulls that irritation. And that conversion doesn't always take in place in all of the skin cells, which is also why, like, it's only happening in the cells that are dividing, which is why it's still working, but far less irritation. And that is why we recommend retinol or retinal products to patients that maybe are beginners or have sensitive skin, who have anti-aging concerns. I would say, though, if you struggle with acne, retinol and retinal are not going to be as effective. I think this is where you want to use something like adapalene that's going to more effectively turn over the cells, unclog pores, help with blackheads, whiteheads, and a little bit of that inflammatory acne.
Yeah. Okay. So if you're totally lost and you are not nerding out with us and you're just like, Dr. Lindsay, Dr. Jenny, just give it to me straight. Give me the overarching view. So this is how it goes. You have the in the weakest side, you have the retinols, and then the retinaldehydes, and then those are all over the counter. Then stronger than that is adapalene, which used to be prescription and is technically a retinoid, which can treat acne. Then if you need something stronger than that, you get into the prescriptions where the tretinoin sits, which sits at 0.025, 0.05, and 0.1. And then stronger than that is your tazarotene. And that's going to be the strongest of all of them, targeting different receptors. So when you're looking at what you can and can't treat, all of these can technically treat aging, but as you go further down the line and you get more aggressive, you are trading off those aging benefits. You're getting aging benefits, but you're dealing with more irritation. So from the beginning, less irritation and weaker, to the end is more powerful, but more irritation. So look at it like a scale. So it's trading off one for the other. So if you are more sensitive, you want to stay at the lower end with the retinols and the retinaldehydes. If you're treating acne, you have to start at adapalene and go from there. And then for those with really severe comedonal type of acne, you want to go with more of the tazarotene. So that is the breakdown. And then if you have, thicker psoriasis plaques, you want to go with something that's really going to thin the skin down, and that's going to be your tazarotene.
Yeah, great summary. And just because retinol, just because retinol and retinaldehyde, I mean, they're all, I would categorize them together as one group, even though retinal or retinaldehyde is one step before the retinoic acid conversion. The formulation is very similar to retinol. Would you agree, Lindsay, that they're all going to be really suitable for beginners or those who are sensitive skin, or just want kind of like have mild signs of aging, uneven skin texture, skin tone, purely for anti-aging concerns. And so there are actually some studies that do show that few over-the-counter retinaldehyde products have similar efficacy as far as improving that skin quality, giving you that glow, improving texture and tone compared to like a tretinoin. So don't underestimate just because they're cosmeceutical that you're not going to get great results with those. You can get excellent results with over-the-counter products.
Completely agree. Well, now that we've broken down all the different kinds of retinols and retinoids, let's talk about who they're for and who they're not. So I think the biggest thing that you need to know about retinoids and retinols is you absolutely should not be using them if you're pregnant, and we will tell you why.
So this is where it's just that potential for birth defects. And this is purely just concern because we never want to take any risk with pregnancy. And we do know that oral Accutane or retinoids absolutely causes birth defects. So we want to be safe. Even though there is probably minimal absorption into your skin, the topical use and the amount that you use on your skin, we never will tell our patients to continue a topical retinoid of any form, including retinol, retinaldehyde over the counter, if you are pregnant. So this is the one thing we would want you to stop.
Yeah. And again, it's really out of an abundance of precaution because this is a very similar molecule per se. It is the topical version of Accutane. And if you know anything about Accutane, if you know anyone who's ever been on it, if you've ever been on it, you absolutely cannot get pregnant when you're on it. And I saw these like really funny TikToks recently about how they really drill it in that you can't get pregnant when you're on Accutane. Like every time you open up, I've actually never seen Accutane. Like I've never seen the pills, even though I prescribe it every day. That when every time you open it up, it has like a picture of a pregnant lady on it. And it's like, do not get pregnant. It is very serious if you get pregnant on Accutane, but it kind of, it's an extrapolation that if you are on the topical version of it, such as similar molecule in the skin, that we just don't recommend it. Yeah. But I highly doubt that there's enough systemic absorption that it would make a huge difference. I mean, I've known many women who have accidentally got pregnant when you're on it. Yeah. So if you are on it and you accidentally get pregnant, don't freak out. The chance of there being any issues with your baby and delivery is almost close to nothing. But with that being said, like if you're trying to conceive, I switch my patients off of tretinoin and I'll put them on something pregnancy safe like azelaic acid instead.
Yeah, there are a lot of great options. And also along the same line, you can absolutely use it if you are nursing. I think we said this back a few episodes ago.
I hate when people like say, oh, I have been off my tretinoin for 2 years because, I was pregnant and I was breastfeeding. I'm like, where did you read that? Who told you that? Actually, the internet tells you that. If you type in like, can I use tretinoin when I'm breastfeeding? AI or the first website will be like, no, you can't. And that pisses me off because not only as a woman who has been pregnant twice, it's like you can't do anything. People are just afraid to even treat pregnant patients. And then like, what's your reasoning behind not using tretinoin when you're breastfeeding? Here's what the real data shows and what the real answer is. As long as you don't have like a premature infant and you're not like slathering your tretinoin all over your nipples, you can use tretinoin in breastfeeding.
Absolutely. And if you're curious about why, then I think we talked about it in our very first episode. So go ahead and check that one out. We kind of dive into the reason why you can use it while you're nursing. And then I think that's pretty much, just absolutely stop when you're pregnant or planning to get pregnant. And then you can pretty much use it when you're not.
Exactly. Okay, well, let's talk about some other things that people absolutely need to know before starting a retinoid. So what things should you avoid with a retinoid? Like where does it fit in your regimen? What should you avoid using with it? That is like the number one question I get from my patients. So let's dive into that.
Okay, so first of all, most retinoids should be used at night. I was just like get in the habit of doing that, even though it's technically adapalene because it's a much stable topical retinoid. You can use it in the morning, but I feel like to minimize confusion, I just tell everyone use it at night. Most of the retinol formulations, including Retinal and Tretinoin, absolutely are what we call photolabile, meaning they break down in the presence of light, UV, and even certain ingredients. So just use it at night. 2, you want to avoid leave on benzoyl peroxide. And that is, again, because retinoid itself is such a kind of unstable molecule, if you will, or ingredient that it can easily be deactivated. And benzoyl peroxide is one of them, especially if it's a leave-on product. Now, cleansers are totally fine because when you wash it off, that action that's happening with benzoyl peroxide on your skin stops. So if you're like having acne, for example, and we prescribe you a benzoyl peroxide cleanser and adapalene or tretinoin, and you only want to do this at night, then make that your nighttime routine. As long as you're washing it off, benzoyl peroxide in a cleanser is safe to use with a topical retinoid. Just don't use it with a leave-on BPO treatment.
Yep. So when it comes to how to layer your skincare at night, what I'll tell patients and what you've heard me say a million times is you want two things. You want thinnest to thickest when you're layering, and you want, if you can, the most active ingredient as close to your skin as possible, which is why we recommended before that if you can tolerate it, we want the retinoid, then the moisturizer, and to kind of start with that if you can. If not, then you could do the retinoid sandwich. But essentially what I'd have patients do is use a cleanser, make sure that your skin is dry before you're putting it on, unless you're doing the retinoid sandwich. When your skin is dry, a pea-sized amount of the retinoid. My favorite way, which we didn't talk about, is to take that pea and do the dab method. So you'll go dab, 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 dab. Do not do what they're doing on social media where they'll take the tretinoin and they go do, 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 do. Don't do that. You're overusing your retinoid. And if you're listening and you can't see what I'm doing, it's when they take a tube and they're putting like a million little dots on your face. So don't do that. I would just do a pea-sized amount, dab 5 places, the forehead, nose, chin, and 2 cheeks, and rub it all in from there. And I promise you that is enough to cover your whole face. And then after that, you can do like any other active serums or ingredients that you're using. You can use like your peptides, or if you're using azelaic acid or something, whatever your derm recommends, and then moisturizing. So usually for my acne patients, I keep it simple. I'm like cleanser, retinoid, moisturizer, done.
Yeah, the great tip, because also if you're new and starting on topical retinoid, I'm a firm believer that everyone can use a form of retinoid in their routine. So one thing I think we didn't talk about, I personally strongly feel, is that if you're using a lot of serums, vitamin C and other things in your routine already, and then you want to start a topical retinoid, you should temporarily stop those, because that, even though you're used to using it, you're introducing the retinoid, which is going to kind of freak out your skin. You want to temporarily stop any other potential irritating ingredients just temporarily until your skin adjusts and you get through that retinization period, and then you can reintroduce the product. So like Lindsay said, if you're using a retinoid for anti-aging, not that you can't like use it together with your, other ingredients, but when you're new to it, I would say temporarily stop those and then slowly add them back one at a time. But with that, you should never use your topical retinoid with an alpha hydroxy acid together at the same time. That's going to add more irritation, unless the product is formulated with the two together. It tends to be less irritating. Similarly, don't layer your vitamin C with your retinoids. Again, it's more just the irritation, but a product that's formulated with the two together probably is okay.
Yep. Totally agree. Don't play chemist at home. Don't mix your retinoids with other things. Simplify it. Less is more. That way you'll have the best experience using your retinoid.
Yeah.
But another thing people are terrified of, and I actually think more people know this than don't, is people think that you use your tretinoin and you can't go outside, right? Is that true or false? They're afraid of the sun. They think their skin's going to burn like a vampire.
No, absolutely.
They use a retinoid. Yeah, absolutely not.
Yeah. So retinoids are not alpha hydroxy acids in the sense like it increases your risk of sunburns. I think what the misconception comes from, when I actually took a deep dive in literature, is that oral retinoids, like oral Accutane, because it makes you so dry and irritated that obviously when you're in the sun, that sun just makes your skin more irritated, right? And so I think indirectly people have this confusion that topical retinoids will make you burn more easily. No, but if you do have skin barrier damage and that you're going through that retinization period, if you are just baking in the sun, that sun is going to make your skin more red and irritated. So this is where also, if you're using a retinoid for anti-aging, you should be first and foremost wearing sunscreen anyway. So this conversation,
I mean, come on, people, come on, like wear the damn sunscreen. Wear it.
Yeah.
Okay.
But also, tretinoin does not increase your like it does not make you burn more easily in the sun.
Yeah. The other thing I hate hearing about retinoids is when people will come on, people who are like skin experts or whatever, they're trying to like push some natural substance, which by the way, this is a vitamin A. So like, don't come at me and say this isn't natural. You know what I mean? But I hate when people are like, well, retinoids thin your skin.
Oh my God.
No. Karen, they don't. This is where that myth came from. Okay. And I'm sorry to any Karens. Like, I actually know a few Karens and they're great. So I don't, I love Karens. So I think that the myth came from the fact that it thins your epidermis. So I'm not going to dive too nerdy into this, but when you look at your skin, you have your epidermis, which is a thinner layer on the top part of your skin, which are more of like where you're, and that's with a couple of different layers, but that can be more your dead skin cells. And then you have your epidermis, which is where your collagen and elastin and blood vessels and everything lie. And so what the retinoid does is it will thin that top layer and make it more compact. And so when that top layer is thick, you have dull, listless, lifeless, thick skin, which it does not equate to glowy, healthy looking skin. So it's going to help to increase that cell turnover and shed those, get rid of those dead skin cells, but it's going to actually thicken, and biopsies have proven this, it's going to thicken the dermal layer of the skin, and that's going to give you a youthful, younger look.
Yeah. And that's, gosh, I wish Mamina was here to describe the histopathology of it, because she's derm path trained. But like Lindsay said, as we get older, because our skin turnover slows down, the top layer of that dead skin actually builds up. So it's actually looser. So it appears like it's thicker. And what tretinoin is doing is, by normalizing and speeding up that turnover, it's making that stratum corneum more compact. But when you actually measure the entire length of your skin, which is comprised of the stratum corneum, the epidermis, the dermis, and that actually overall thickens. So tretinoin thickens your skin. It does not thin your skin.
Yep. Which is why you really get that, like, I can tell when someone's on tretinoin. When I have a patient come in and they're asking me for skincare advice, I'm like, I already know you're on the good stuff. Like, I could just tell they have like a really beautiful glow to their skin. It just looks so healthy and plump. And so retinoids, they're the goat. They're the goat. There's no arguing.
Nope. See, I feel like we've said a lot today. I'm trying to think if there are any other tips. I mean, we can go on for hours just talking about retinoids. I feel like we covered.
Yeah. So I think that was like a deep dive into retinoids. I hope we kind of demystified retinoids for you guys and answered some of the common questions and myths that you guys have. Remember that there are different kinds of retinoids. Some are over the counter, some are prescription, and each of them have their own pros and cons.
Yeah. And we love Retinal if you have super sensitive skin or just have mild anti-aging concerns and you want to try something. That is a great start. Or say use adapalene for mild acne, but then certainly can talk to a dermatologist if you want to do a little bit more for your skin. Tretinoin or tazarotene, they can all offer various different type of benefits. And also keep in mind that when it comes to retinoids, less is more, and higher strength doesn't give you better results. It's about finding the one that works for your skin while minimizing that irritation, something that you can use more long term. It's all about that consistency. It's a marathon, not a sprint. The benefits that you're going to see comes after 3 to 6 months and years of use. It doesn't happen overnight.
Okay, well, I think we've covered everything there is about retinoids. I just want to thank everyone so much for listening. Be sure to hit that follow on Apple Podcasts or Spotify, or follow us on YouTube so you never miss an episode. And if you've been loving the podcast so far, we would be so greatly appreciative if you can leave us a rating or a review. It would really help the growth of this podcast. We really can't wait to tune in next week. We have so much more to cover on Skin Deep and Unfiltered. Thanks, guys.
Bye.